Hello, I'm Jorge Gestoso. Welcome to a new program. On today's show, is the coronavirus the best case for Medicare for all in the United States? We ask our guest from New York, Dr. Steffi Woolhandler, distinguished professor, City University of New York at Hunter College and lecturer at Harvard Medical School. Dr. Woolhandler, a warm welcome to the program.
My pleasure.
Doctor, what is your assessment of the way President Trump is handling this pandemic?
Well, I think things are going very poorly, particularly when you take into account that the United States had 2 months of warning that this was happening, that we are the wealthiest nation in the world, that we spend nearly twice as much in medical care as people of any other nation, including wealthy nations. We have all the resources here, we have all the capabilities here to stop the coronavirus, and yet it did not happen. And the United States is now the epicenter of the epidemic, and specifically New York State and New York City are the epicenter of the epidemic, not just for the United States, but for the entire world. And that is frankly a failure of federal leadership at a massive scale that's costing Americans thousands and thousands of human lives.
So you agree then with Dr. Anthony Fauci that an early response could have saved lives?
An earlier response definitely would have saved lives. We should have used the time between when we first learned of the epidemic from China and when it hit to line up ventilators, to line up what we call personal protective equipment, really the masks and gowns and gloves that doctors such as myself and other healthcare workers such as nurses and food service people and cleaners, the equipment that the medical staff needed to safely take care of the coronavirus patients. We should have used that time to slow down the virus and not wait until the middle of March before we realized that a massive epidemic was upon us. Even since that time, the response has been very poorly coordinated. The governors and mayors of effective cities have been scrambling to find the equipment themselves to try to coordinate via phone calls rather than having any sort of coordinated national response that we need in order to save the maximum number of lives.
You made a study that shows that up to 5 million Americans under dependence were losing the health care after they got unemployment in the last 3 weeks. And the projection is that if we continue at that pace, by June it's going to be 13.5 million, with a total of about 43 million Americans without health care. Worrisome?
It's incredibly worrisome. It was worrisome when we started the epidemic and we had 30 million Americans with no health insurance. But in just 3 weeks, we've seen 16.6 million people lose their job. 5 million people lose the health insurance they were receiving through a job. And we're saying that by the end of this calendar quarter, June 30th, we will have 43.5 million Americans with no health coverage. And that means that people have no doctor to call when they get sick for advice. They have no place where they can go and know that they'll be taken care of. Once they do go for care, if they're desperate because they can't breathe, they may be facing thousands, tens of thousands, even hundreds of thousands of dollars in unpaid medical bills that can bankrupt their family, that can leave them homeless, and that can spoil their credit so they're never able to start a business or borrow money in the future. So and this is all entirely unnecessary. Other developed nations say everyone who lives here is eligible for health care. That's in Canada, in most of Europe. In many nations much less wealthy than the United States, they have a national health program, what we would call Medicare for All, where if you're sick, you go get the care you need and you don't worry about the bills because the care has been paid for already through your taxes. We needed that system in the United States a month ago, and we desperately need it now in order to let people get the care they need and reduce the loss of life that we're going to see from coronavirus.
So, Doctor, is the coronavirus the best case for Medicare for all? And please explain to our audience what is Medicare in the United States.
The current Medicare program is a federal program paid for by taxes that covers everyone in the Social Security system over the age of 65 and a few million other people who are disabled or have other problems. But it's mostly a pretty good social safety net for people over the age of 65. It's extremely popular with the patients because it can never be taken away from you. You can use it to go see any doctor or get care at any hospital in the U.S. So consequently, when we talk about universal health care in the United States, when we propose universal health care, we do explain it to people as Medicare for everyone. Medicare that begins the day you're born and follows you your whole life. Medicare that covers all of your medically necessary care without co-payments or deductibles or uncovered services. The group I work with is called Physicians for a National Health Program. We have 22,000 physician members, and we've been advocating Medicare for all for over 30 years. Bernie Sanders, way back when he was Congressman Sanders, and then when he was Senator Sanders, and more recently when he was presidential candidate Sanders, has also been advocating Medicare for all for decades. We needed this a month ago when we had 30 million uninsured people. Right now, as literally millions of people are losing their job every month, millions of people are losing their employment-related insurance every month. We now have an additional 13.5 million people who are going to desperately need Medicare for all. So we definitely have a very strong case for Medicare for all. For many decades, there's been individual tragedies. An individual lost their job, they lost their health insurance, they were bankrupted by the cost of medical bills while they were uninsured. But now we are facing that tragedy on a society-wide level as 16.6 million Americans, 1 in every 10 American workers, has lost their job in the last 3 weeks. And most of them are facing loss of employment-related coverage.
Dr. Woolhandler, I invite you to make a little break and we continue to talk in a minute. We're talking with Dr. Woolhandler from New York regarding of Medicare for all. We'll be right back. We're talking from New York with Dr. Steffi Woolhandler, Distinguished Professor of City University of New York at Hunter College and lecturer at Harvard Medical School. Doctor, you have said, and I read your words, a lack of Medicare for all is forcing us to fight this epidemic with a hand behind the back. And that involves everyone, including rich people with insurance and also people with no insurance. Why?
Okay, well, the key to controlling an epidemic is for people who get sick, even a little bit sick with a respiratory illness, even some sneezes and coughs that you don't expect. Those people need to stay home, and then they need to get tested so we'll know whether they have coronavirus or not. And if they don't, then they can go back out as soon as they feel well enough to do so. And if they have coronavirus, they need to stay home until they've been completely without symptoms for 14 days. This is absolutely essential to stopping the spread of the coronavirus. And this is what was done in Singapore and in Taiwan and in parts of China where they were actually successful at nipping the epidemic in the bud, at stopping the epidemic early before it could spread throughout the population. But that simply can't happen if you have a large number of people who have no one to call when they're sick, who have no place to go to get tested, who don't have any sick pay.
Doctor, you were mentioning certain figures. You're saying that, for example, 25% of cab drivers have no medical insurance, 12% of home aides, 15% of cleaners. And another issue that came absolutely to the surface is that the minorities are being the ones who die the most, especially the Afro-American community and also the Hispanic. Because you're trying also to emphasize that, for example, if the rich believes that they are protected because they are in self-quarantine, they are in contact with these people. So even if they feel that they are with contagious with the virus, they're going to get it from the poor people that have to go to work and get in touch with them. Is that a little bit what you were trying to show, that this is, your words, this is a pandemic that affects us all, rich and poor?
Yes, well, it is an epidemic that affects us all, rich and poor. And many we call minority workers, Hispanic workers, and Black workers work at jobs where you have to show up. You cannot telecommute if your job is driving a delivery truck or preparing food or scrubbing the floors at a hospital. And it turns out that many of our essential workers who have to show up, who can't stay home in the United States, are Black and Hispanic. Additionally, our Black and Hispanic populations tend to live in more crowded conditions, so there's more spread within their homes and communities. They're more likely to be low paid so that they have to use public transportation and don't have the option of driving to work in a private car. And issues like stocking up on groceries, so you only have to go to the grocery store once every 3 weeks. It's very easy if you're a high-income person with an automobile, but very difficult for low-income people who may not have the cash to buy groceries 3 weeks ahead of time. For all those reasons, we're now seeing, and this has happened since I wrote those words, we're now seeing extremely high rates of COVID infection and COVID death among African American communities and in many cities among our Hispanic communities as well. For instance, East Boston and Chelsea and the Boston area, and many of the outer boroughs, as we say, the parts of Manhattan outside, the parts of New York City outside of Manhattan, where many Hispanic and Black people live, are seeing the highest rates. So, however, when you go to the grocery store, even as a rich person, you may be encountering one of these lower income people. When you have to take a taxi, when you get a delivery to your door, when you go to the hospital and that hospital room has been cleaned by a low income Black or Hispanic person, then you as an affluent person are being exposed to the virus. And this is completely unnecessary to have placed our Black and Hispanic workers at elevated risk. Everyone deserves medical care. Everyone deserves protection from coronavirus. Everyone deserves a living wage. And by failing to provide that safety net to our poor and Black and Hispanic workers, we're actually endangering the lives of everyone throughout the society.
Questioning the private health insurance system of the U.S., you were retweeting a tweet in which David Himmelstein said in Modern Healthcare, and this is a quote, "Coronavirus shows that private health insurance is like an umbrella that melts in the rain." Is it melting in the rain this time?
Private insurance is clearly an umbrella that melts in the rain. If you lose your job, your health insurance is usually over in the last day of the month. So the people who lost their insurance in late March, lost their jobs in late March, had no insurance beginning April 1, right as they were facing the possibility of a life-threatening illness from coronavirus. So right when people needed the health coverage the most, their private health insurance disappeared. And this happens when there's not an epidemic going on. This happens all the time. Some terrible thing happens at home. Perhaps a family member becomes sick. You become sick. You're unable to work. You lose your job, and you will lose your health insurance. And that is no protection at all. Protection only when you're well enough to go to work is really no protection at all. And it's very easy if you're healthy and working and you have this private health insurance that seems like good coverage. It's very easy to think you're protected. But I think the coronavirus epidemic is really showing workers that the minute you lose your paycheck, you lose the protection of your private insurance. And right now, that's a disaster.
Dr. Woolhandler, I want to ask you, make a little break and we continue in a minute. We'll be right back. We continue talking to Dr. Steffi Woolhandler. She is a distinguished professor of the City University of New York at Hunter College and lecturer at Harvard Medical School. Dr. Woolhandler, talking about tests. We're talking about a country of 330 million people, and so far, less than 1% has been tested. Is that a key issue in order to assess how grave is the coronavirus in the U.S.?
The lack of testing in the United States is a catastrophe, and it's a completely avoidable catastrophe. At the beginning of this epidemic, a very good test that had been approved by the World Health Organization, the WHO, was available through European countries, mostly in Germany. But for whatever reason, the federal government decided not to purchase those tests from Germany, but to develop our own test and to have no backup system in case our own testing capacity was inadequate. And lo and behold, our own testing capacity turned out to be inadequate. The test that the U.S. invented was faulty and didn't work and ended up being in very short supply. Consequently, we are months into this epidemic and we still have no idea how many people have been infected, how many people are now immune. We're still not getting tests out, and of course, reopening the economy once we get control of the number of cases depends on having availability of tests. Part of why it spread so widely and so fast in the United States is we were not testing anyone because we did not have the US-based test, and we had not made the wise decision to buy some of the German tests as a backup system. So the failure of testing in the United States has been catastrophic. It has caused massive loss of life. It has caused a much bigger epidemic than we would have had otherwise. And even moving forward, we still don't have testing. So it's going to slow our ability to control coronavirus going forward and safely return people to work and get the economy going again. So this is an absolute disaster that occurred with testing in the United States.
What about a vaccine?
Well, a vaccine would be very good. The earliest the vaccine is likely to be available is 18 months. And we certainly hope that a vaccine is available as soon as possible. That could shorten the epidemic as well. But it could, likely 18 months could be longer than 18 months because you have to develop the vaccine and you have to test it carefully to make sure it works, because not all vaccines even work. But once we have the vaccine, we can produce it, we can immunize people and bring the epidemic to an end. But that's very far down the road at this point, 18 months at a minimum, possibly more. And it's imperative that we use the tools we have now to control the epidemic. And the tools we have now are testing, asking people to stay home when sick, quarantining people who we identify through tests to be carrying the virus, and giving good supportive medical care to people with serious cases of the virus. The majority of people entering the hospital with the virus do recover. It's very serious and many people die, but most do recover. But we need to make sure that we have the capacity to give everyone the care they need to maximize their their chance of recovering.
You were mentioning Senator Sanders, who dropped a few days ago. And as you were mentioning, he has been proposing and pushing for Medicare for all, as you said, for decades, like 30 years. And when in this presidential campaign he was proposing once more, immediately he received a barrage of criticism, naming him communist, socially crazy, that this is too expensive, that we, the US, cannot afford something that expensive. And at the same time, in mainstream media, you were not hearing at all when President Trump is proposing a 10% increase of the military budget of trillions of dollars. So again, if you're watching this from overseas, how is possible that the American people, 330 million people, goes behind the criticism of someone that is trying to save the health of the whole population, and at the end of the day, again, the message of the private health industry and their interest is the one that prevails? How you explain that?
Okay. Well, exit polls that were taken during the presidential primary showed that the majority of the American people supported the idea of Medicare for all. So I think Medicare for all has won the battle of ideas. I think people had questions about Sanders' electability, and that's why he's not going to get the nomination. But if you ask people, do you want Medicare for all? A majority of folks leaving the polls said that they wanted it. And I think American people, even before this epidemic, saw that the healthcare system was broken. And to be honest, the idea that Medicare for all is more expensive than the current U.S. system is simply not true. The United States already has the world's most expensive healthcare system. We are spending $11,000 per capita on medical care, which is twice the amount that they spend in Canada or Great Britain or France that have very good healthcare systems. So we were already spending twice of what other nations are spending, and those other nations have national health programs like Medicare for all. So the idea that we could not afford Medicare for all was a lie. And the truth is that we can't afford not to have Medicare for all. The reason Medicare for all is cheaper is because it's much cheaper to administer. It involves much less paperwork and bureaucracy. When you need care, you just show up at the hospital, you show up at the doctor, and they give you the care, and the government pays salaries to the doctors and the bills for the hospitals. That's a much cheaper system than what we have in the United States. We have to sign up for health insurance. You have to enroll. You show up at the hospital. They have to figure out what your insurance is, what your copayment is, what your deductible is, whether you're in network or you have to go to another hospital, what part of the bill the patient pays, what part the insurance pays. All of that extra administrative work and bureaucracy is costing the U.S. healthcare system almost 18% of total health spending. So money, basically healthcare dollars that are just burned, basically thrown away on the excess bureaucracy of trying to run a health system as a private business rather than a public service.
Dr. Steffi Woolhandler, thank you very much for joining us.
It's been my pleasure.